At this point, I no longer do equine practice as a vet. I can say that I have switched completely to being a trainer, a positive reinforcement trainer, a cooperative care trainer, an ethical trainer. Those are all the labels that I give myself when I describe what I'm doing. Am I okay with not doing that practice anymore? And what made me make that change, that switch from being an equine vet to being a trainer? This is what I want to talk to you about in this episode. Hey there, you are listening to another episode of the Vet Care Training Podcast. I'm Dr. Katerina Junghanzová, a former equine vet, now cooperative care trainer, and my job is to help people help their horses or their equines feel more comfortable in vet and husbandry procedures. I have founded an educational project called Vet Care Training, which this podcast is a part of, and I have amazing students all over the world who decided to become a better person for their horses and start helping them feel more okay with real-life situations such as vet or husbandry procedures. With that being said, let's dive into today's episode and talk about what has made me make this switch. Hello. This is just a little spontaneous episode of the Vet Care Training Podcast that I have literally just sat down and now I am recording it because I have been thinking about my life trajectory and all the things that happened in the past and how my life has changed over time. And I realized that although I am still technically an equine veterinarian, I no longer do the practice. I no longer have my own practice. I no longer see equine patients and provide treatment. And I switched completely to being a trainer and getting horses ready or helping their owners and their caregivers get those horses ready for what I call real-life situations. It can be vet procedures such as injections or deworming or possibly some wound cleaning or maybe trailer loading or things like getting horses used to fly sprays or clipping, things like these. Or it can also be problem solving. So I am working a lot with needle shy horses. That's why I am working on creating a program for helping needle shy horses that you can study within the Vet Care Training online education. Yeah, because I know many needle shy horses, and back when I was an active veterinarian, when somebody called me and said that this horse doesn't like veterinarians, most of the time those horses were needle shy. Or the biggest problem was to give the horse an injection. So needle shyness is a big problem. And that's why I would like to really focus on this topic within my vet care training project. So as a vet, I often had to manage these horses somehow. I had to handle these horses to be able to provide them with all the care they needed. And I would have to be really patient with some horses or really smart with the others to be able to handle them safely. But what I didn't like was that oftentimes there was a lot of stress involved. For both us, the humans, me as a vet, the owner or caregiver or whoever was there helping me with the horse, as well as for the horse. And then I realized how unprepared these horses are for these real-life situations. I talked about this in the very first episode of this podcast, so I really suggest that you listen to this episode or re-listen because, really the biggest problem isn't that those horses are stubborn or naughty or, trying to establish their dominant position, but these horses are actually unprepared. And as a vet, I realized how big of a problem is this: how unprepared these horses actually were to handle these situations without unnecessary stress. And that led me to thinking about approaching these equine patients differently. So initially, I founded a methodology that I call the non-conflict handling or the non-conflict care. It's my own term that I'm using for this technique, because initially it helped me take care of these horses without unnecessary stress and without causing conflict. So hence the name non-conflict. It isn't like an official term, but it's the name that I gave this methodology or technique. It is very similar, though, to techniques called considerate care or low-stress handling. It isn't true cooperation. We are not training horses to cooperate or to give their consent, but we are basically training our horse patients as we go through the procedure, and we are teaching them to tolerate the procedure. For this, I'm using negative reinforcement and other techniques such as counter-conditioning when possible, or systematic desensitization, again in the combination with counter-conditioning where possible, because for counter-conditioning we often use treats and not every time it is appropriate to give a horse patient some food. So if you are a positive reinforcement trainer or someone who identifies as ethical trainer, then hearing about me using negative reinforcement can be like, wait, you are describing yourself as ethical trainer, positive reinforcement trainer, and now you are telling me that you are using negative reinforcement with your patients. Yes, because, hear me out, there's one thing that is very important and that could make possibly any vet procedure less stressful if we knew this one thing and started to apply it. And the thing is that every procedure or every part of it, every interaction with a horse that is a little stressful, painful, or otherwise aversive, and it doesn't have to be very aversive, like very painful, very stressful, just a little bit aversive in terms of the horse not liking it, okay? So every procedure, every situation that is a little bit aversive creates pressure. It creates pressure just like when we are training with negative reinforcement. And it basically applies to all of the vet procedures: farrier work, clipping the horse, possibly trailer loading if you haven't trained trailer loading with positive reinforcement before. So imagine that there is a vet who wants to give your horse an injection, and the closer the vet gets to the horse, the more the horse becomes stressed or scared. And at this time, what you can do, and you don't have to train for it previously, you can just work with the distance. You can work with the distance. As a vet, you can stop approaching the horse and give them a little break. Maybe take a step away from the horse. And when you do it while the horse is standing still, you are reinforcing the very behavior that the horse was doing, which means standing still. And this is literally how you can train the horse to tolerate whatever procedure you need to do as you go. And when you don't have time to train the horse to cooperate in this specific procedure, or when something happens, when there is an emergency, it's an easy and ethical way of how to communicate with the horse and how to get the procedure done without causing the horse unnecessary stress or without getting into unnecessary conflicts. So this is what I have started doing several years ago, many years ago, in fact. And this is what I probably will be talking about a little bit more in this podcast, or maybe in other courses or lectures or something like this, because this is so important. Not every time we have time and space to get horses ready to the point where they cooperate voluntarily, but we can still teach them to tolerate those procedures. And we can still do it without unnecessary stress. So these were my beginnings many years ago, because of course I grew up in a traditional horse training environment. Back then, when I started around 30 years ago, positive reinforcement wasn't a thing. Not in the horse world anyway. So this is when I realized that horses who don't want to cooperate and who behave in a dangerous way sometimes are actually unprepared, and that when I want to provide them with the best care, which of course I wanted as a vet, I wanted to do my job in the best way I possibly could. So if I wanted to take the best care of my equine patients, and of course I'm a lifelong horse girl, so I had been training horses even before I became a vet, and I was really particular about not causing horses stress in training. So, of course, I wanted to make this low-stress handling a part of my job. And then I learned about cooperative care, and I decided to take it one step further and actually start training horses to cooperate in their care. And I literally started just by giving horses treats after or during the procedure. When they were standing still, they would get a treat. So in the beginning, it was pretty messy. But over the past couple of years, I have to say I really polished my way of training horses to cooperate in their care. I do consent-based care, which is basically consent, I would say, is the cornerstone of cooperative care. Because when you want your horse to cooperate with you voluntarily, it has to be based on their consent. This is how I see it. It has to be based on them taking the first step and literally showing you that they're ready for the procedure to begin. So this was when I started experimenting with consent-based care and cooperative care, and I realized, wow, these horses actually want to cooperate. And these horses who nobody was able to give them an injection, they now come, and by touching a target or by doing another start button behavior, they literally say, yes, you can come and give me this injection. And I was blown away by this. And then I realized I don't want to go back to handling uncooperative horses in a stressful way. For me, there was no way back. And then I realized there was no one like me, at least not in my area. Or maybe I was the only one in my country doing this at some point. Because I know there are a few people who started doing cooperative care and teaching cooperative care with dogs, but now I know a few people who do this with horses as well, but there are just a very few of us. But I think it is so important, it is so freaking important that the horses are ready for their care, because otherwise we wouldn't be able to give them the best care they need, and we wouldn't be able to do it safely. Safety is a big thing when working with horses. They are big, they're strong, their flight response is still there, and they can get startled when we put them through a situation that they are not ready for. So at this point, I had realized that I didn't want to work with horses who were not ready. And since cooperative care wasn't really a thing back then, I realized that I would start putting my effort into teaching people how to get their horses ready for the most common real-life situations. Then I got ill. I literally overworked myself to collapse and developed what is called a chronic fatigue syndrome or myalgic encephalomyelitis, which is a shitty condition that I will probably have to live for the rest of my life. But at least I found out what works and what doesn't and how to keep myself in the remission. So after several years, I am finally coming back to life. And yes, I get tired very easily. My brain gets overwhelmed really easily, and my muscles hurt sometimes, but yeah, I'm functioning. And during my worst period of this illness, when I was bedridden, I was studying a lot and I was working on creating a training program that would help me teach more people how to help their horses get comfortable with vet and husbandry procedures. So this was when I started creating vet care training. It was back in 2018, and that was in the beginning of my illness. And through many ups and downs health-wise, I was studying and working on my educational program, and I was slowly realizing that I wouldn't be able to come back to practice because I was very busy as a vet, and I did a lot of emergencies, a lot of stud farm healthcare, equine reproduction, colic emergencies, and all the field vet stuff that made me work 24/7, and this isn't possible for me now. Do I miss it sometimes? Yes, I do. And I realize that when I'm speaking to my colleagues and they still come to me for an advice, or when we discuss some difficult cases, I kind of miss it, and I kind of start thinking, oh, what if I come back to my practice, but then I realize it isn't possible for health reasons. So do I miss it? Sometimes I do, yeah. But I also feel like I have a very important work to do here, and it's what I do. It's teaching people how to get their horses ready for these situations. This has really become my number one task in my life right now. And this is how I switched from being a vet to being a trainer, basically. Yeah, so even if I am pretty hesitant to call myself a trainer, this is what I do, and this is what I love doing because I love seeing the results. I love seeing horses voluntarily cooperating in their care and giving their consent to vet procedures, when before those horses were hard to catch once they saw that there was something happening with them, that the vet came to the barn. So this makes a lot of sense to me, and this is what I will continue doing because I think it's the basis. Like, this is literally the basis for good healthcare. When the horse is ready, they will tolerate all the procedures better, which means that we can provide them with better care, which ultimately this is what it's all about, to keep our horses happy and healthy. And keeping them happy also means that we don't put them through unnecessary stress. And oftentimes people say, oh, it's necessary. It's necessary for the horse to survive, so to speak, the vet visit once or twice a year or a few times a year. But I don't think we should take it as an excuse to putting the horse through unnecessary stress, because it doesn't have to be stressful. If you start working on getting your horses ready for these situations, vet visits will get less and less stressful each time. And then you may get to the point where your horse will be perfectly okay with the vet doing whatever procedure, and that the horse will give you consent, their active, willing consent, with the procedure you or your vet has to do. So if you want to learn more about how to start getting your horses ready, I have a free online course where I'm speaking about the principles of equine cooperative care. I will put the link below this podcast. And also, a few times a year, I open my signature program called the Cooperative Care Kickstart, where I am working with students to train their horses to cooperate in different healthcare procedures. Also, this podcast is a place where I'm talking equine cooperative care and all things related. So don't forget to hit subscribe wherever you're listening so that you never miss any future episode. Thank you so much for listening and see you in the next episode.